Alright, so I apologize that this is not on Coursera or the media recorder. Neither were working on my laptop, so I just decided to go on CapCut and try to do it this way instead. For my research project, I chose to focus on unsafe working conditions for Latinx migrant agricultural workers. And my research question is, how do unsafe working conditions affect the mental and physical health of Latinx migrant agricultural workers in the United States, and how can policies better protect them? So, Latinx and migrant workers play a huge role in industries like construction and agriculture, yet they often face some of the most dangerous working conditions. These conditions include extreme heat exposure, injuries, and exposure to chemicals like pesticides. Despite the vital work that they do, many workers experience unfair treatment and a lack of access to health care. This issue raises concerns about human rights in the U.S. and brings up where there is inequity in worker safety. So the reason why I chose this topic is a couple of reasons. Number one, a lot of the classes that I'm taking actually talk about Latinx workers, and I'm in intersectionality right now, and we talked about that, I think, when I chose my research project, and so I was really passionate about it because I was reading a bunch of articles on it from both this class and also intersectionality. But also, migrant workers are very overlooked in discussions about healthcare and workplace safety, even though they experience some serious health risks, a lot of the times more than a lot of other jobs in the United States experience. And a lot of people benefit from the work that migrant laborers do, and I don't think a lot of people realize the conditions that they are working in. And it's important because of not only because of the physical health problems that migrant workers face, but also the emotional and mental effects that these conditions have on workers and also their families and home lives. So I will be discussing the health challenges that migrant workers face, the causes, and the effects on both physical and mental health. And then we'll go into some solutions that could help improve health incomes for these communities as well. So, for health impacts, unsafe working conditions negatively affect the physical and mental health of migrant workers. Health risks include injuries, heat exhaustion and dehydration, exposure to dangerous chemicals, higher risk of workplace injuries, respiratory problems from dust and chemical exposure, skin conditions and irritation, spread of infectious diseases, poor nutrition and fatigue, limited access to healthcare and medical treatment, lack of protective equipment and workplace training, untreated illness or injuries out of fear of losing employment. Mental health is impacted greatly for migrants due to stress, fear of deportation, and isolation. So, a lot of the time, migrant workers continue to work when they are sick or injured because they can't afford to miss work, and many families depend on this income. So workers may prioritize financial need over survival, and this can make illnesses and injuries much more severe in the long term. But also, a lot of migrant workers don't have access to health care, and so even if they did take time off of work, they still wouldn't be able to get treated, or they would have to pay out of pocket, and a lot of the time they're not getting paid much as it is, or don't have money to put towards this, and it's extremely inaccessible, especially for migrant workers. And just the access to preventative care that they don't have, so they don't have regular doctor's visits or screenings or checkups. And so there's a lot of health conditions that can become very serious if they're undiagnosed. And this is contributing to higher rates of untreated illnesses among migrant populations. So there's all these different impacts, and the thing is it's not really just centered around one. And these jobs, when you actually look at it, it's crazy how many different impacts there are, and how migrant workers are just trying to do their jobs and are fearing deportation. And we'll get into this a little bit later, but a lot of employers treat migrant workers unfairly because they know that they're not going to get in trouble for it with the law, or that people won't find out about it. So that's a whole nother thing. But migrant workers are severely impacted physically and mentally from these jobs, but they are afraid to leave because they need the job. Weak labor laws and environmental hazards are contributors to unsafe working conditions. So employees refusing to pay overtime wages because workers are afraid to report violations. This is probably one of the biggest ones. Workers being forced to work in extreme heat without proper water or breaks. Unsafe construction sites where migrant workers are not given helmets, gloves, or other safety equipment. Employers threatening to call immigration authorities if workers complain about injuries or poor conditions. Workers continuing dangerous jobs after injuries because they fear losing employment. Lack of reporting for workplace accidents because migrant workers fear deportation or retaliation. Companies hiring migrant workers for long shifts that exceed legal work hour limits. Exposure to harmful pesticides or chemicals without proper training or warning labels in workers' native languages. Wage theft, where employees withhold pay or pay below minimum wage knowing workers are likely to report it. So, like I said, employers really like to try to weasel their way out of different laws and regulations that are in place. When we talk about solutions, we'll talk about there are OSHA regulations and things in place, but they're not being followed because there's no one to really follow up on if they are or not. A lot of the times, people from these departments don't get out and go to make sure that things are running the way they're supposed to. And even if they are, there aren't really penalties in place, so employers don't really care. And this is just a big issue all around. And the biggest thing too is these migrants don't want to report any of this, any of like workplace injuries or ways that they're being treated that are unjust or unfair because they worry about losing their job and they need it to provide for their families. And they're worried that they're not going to be able to find another job. And employers know this as well, and so they kind of exploit it. And they threaten migrant workers and underpay them and steal their money and stuff like this because they know that migrant workers aren't going to say anything about it. So my graph in the top right corner is talking about agricultural workers are more likely to be uninsured and go without needed care than citizens. So this is just showing that imbalance and that inequality in the United States, specifically dealing with healthcare and insurance. And a lot of migrants do not have it or do not have access to it. So for solutions, stronger policies and more in-depth services would help protect migrant workers. So the current solutions are OSHA regulations, right? So these are in place, like safety protocols to help keep workers safe, worker safety training programs showing workers how to properly and safely get things done. There's state heat protection laws in California for sure, so you can only require your workers to be outside in a certain heat for a certain amount of time. Community health clinics and nonprofit organizations that set up different programs and help assist people who do not have access to health care, and advocacy groups that are advocating for more rights for migrant workers and are standing up for the unjust laws that are in place or that lack thereof. But many of these solutions don't work, especially in jobs with migrant workers. Labor laws continue to stay unenforced. Migrant workers may not fully understand their legal rights because of language barriers. Safety training programs aren't always available in workers' native languages, and inspections to assess these workplaces are infrequent and the penalties are weak. And then for potential solutions, stronger enforcement of labor laws, legal protections for workers regardless of immigration status, expanded access to affordable health care, workplace safety training programs, providing training materials and legal information in multiple languages, increased workplace inspections in industries with high numbers of migrant workers. So some potential solutions could reduce injuries and improve healthcare access for migrant workers, but they would require funding, stronger enforcement, and political support, and these changes may also face resistance because of immigration debates and workers' fear of retaliation. So it's kind of up in the air because there are things that we can do and should be doing, but people are definitely going to fight back against that. Our country is unfortunately a very divided place right now with a lot of messed up things going on. In conclusion, migrant workers play an important role in industries that support the U.S. economy, yet they continue to face serious physical health risks and unsafe working conditions. Improving labor protections, healthcare access, and workplace safety enforcement could help create safer and healthier environments for migrant workers.